Awareness Week. And for more on this, we're joined live by Dr. Jesse Hanson. He's with the Helix Healthcare Group. You're the clinical director. Good to see you again.
Thank you. So happy to be here.
And now you focus mainly on trauma resolution.
Yes.
And sort of stress.
Yes.
And it's something that we can all definitely attest to, being stressed. But not a lot of people are aware necessarily of the detriment of that and how we're seeing it on so many levels.
I think one of the most common misunderstandings is that, oh, that happened in the past. What does it matter anymore? Or I've talked about it, I've forgotten about it. But what we know from neuroscience is that these events from our past, especially those that are traumatic, that stick with us, they live on in our nervous system, and we need to actually learn how to reprocess that or resolve it. And I think also with everything that's happening in Fort McMurray and things that are happening in Toronto with more crime, it's like there's trauma showing up in our culture, and we are, in my opinion, not yet culturally sensitive or culturally aware about how it actually affects us.
Interesting. Of course, yeah, we're seeing that in many ways, as you mentioned, in our society. But what are some of the tools? I mean, it's a big topic, of course.
Topic.
But I know you're going to be presenting coming up at the end of the month.
Yeah,
at
the Addiction and Mental Health Conference here in Toronto, and it's the 4th annual one. I'm very honored to be there as well.
And so your focus, the name of your presentation is the road back from trauma.
Yeah.
So what are some of the things you're going to touch on?
Great. So in a very short nutshell, I would say that the most common misunderstanding is that in talking about traumas, we're somehow healing them or making them go away. And it is helpful to start that inner conversation and or with a friend, a family one, a therapist, whoever it would be. But the main thing we know is that trauma actually needs to be reprocessed in our nervous system. In other words, the way that is remembered by our body is not forgot the same way that our mind would say, oh yeah, I'm over it. Right, our body will remember, and I think that's the hard part is that it's still relatively new understanding in the world because neuroscience is just now starting to really show us what happens with trauma. So in terms of resources, I mean, obviously the work we're doing at Helix Healthcare Group, we do integrate different holistic and traditional models to help people move through the trauma. The key is, though, it cannot just happen through talk. There has to be a body awareness. There has to be an experience in the body to actually help our nervous system relate to it differently so that we don't experience what some people will call PTSD, post-traumatic stress disorder, or even without that full diagnosis, I believe we all have painful memories from our past that we may say we're over it, and sometimes we are and sometimes we aren't. And that's the part people don't realize.
Who's dealing with that, yeah.
Yeah, and just one other quick cultural sensitive point is that as a culture, my hope is that we can start to be more aware and sensitive to each other and even ourselves about how trauma might be impacting us, and even the people in the fires right now, to have compassion for them and recognize they're going to be out of balance for a little while as they make peace with all of this.
Of course, and the awareness is the key part of it. Dr. Jesse Hanson, thank you so much for being here.
My pleasure.
Okay,
Thank
take care. It is now 12.